And this is a very important point because the words universal health coverage are being bandied around a lot. And the way it sounds, they said that they're going to achieve universal health coverage. Currently, MediShield covers 92.8% of the population. There are about 7% of the population who are not covered under MediShield. So the idea is that they're going to expand the 92.8% to 100%. And that is equal to universal health coverage. But to me, and as my understanding of the WHO definition, that is not universal health coverage. That is a safety net. See? And Singapore has a safety net. As I said, if you have no money, your family has no money, you will not be denied hospital care. The government will chip in. See, they will provide Medifund, they will provide the resources to chip in. So that is a safety net, and we've always had that. We've always had universal health coverage if you define universal health coverage as a safety net. But what the WHO has defined, the World Health Organization has defined universal health coverage in the Director General's speech of 2010 means that everybody has equal access to basic medical health care. That means if you need treatment for your hypertension, your high blood pressure, you get access to the treatment so that your blood pressure is controlled to internationally acceptable standards. And you do not have to worry about the out-of-pocket payment. You don't have to cut down on the number of drugs you're taking just because you're worried about the cost. That is the international WHO definition of universal health coverage. It's very, very different from what at least is appearing in the media as an explanation, not this going from 92% to 100%. See? That is not universal health coverage as far as the whole world sees it. See? So I think there's a very important distinction between safety net, which we've always had, and thank God we have it, and universal health coverage, you see, which is very different, which means it's a comprehensive thing. It looks after preventive care, primary care, all the other things, not just when you're really very sick from some terrible disease.